everyone, and welcome to a new session of clinical pharmacology, drug therapy, and clinical research. Today, we are going to speak about or continue to speak about the generic name, brand name, and drug category, pharmaceutical forms, and dosage. Next topic today will be focusing on the cardiovascular system, clinical pharmacology of cardiovascular system. I am Dr. Khalid Hassan, Professor of Clinical Pharmacology, Drug Therapy, and Clinical Research. Okay, in the first part of cardiovascular clinical pharmacology, we are going to speak about antihypertensive medication. Again, we are going to mention the generic name, brand name, drug class, and pharmaceutical form and dosage. Okay, as you can see here from this table, we have a group of medication category calcium channel blockers. Here we talk about calcium channel blockers. Another abbreviation for this one will be CCBs, calcium channel blocker. We have amlodipine, diltiazem, nifedipine, verapamil, amlodipine. Okay, we'll start with the first medication, amlodipine, a brand name Norvasc. Amlodipine belong to the category of dihydropyridine, CCB, calcium channel blocker. Amlodipine used for treatment of hypertension, angina, stable angina, or like vasospastic angina. Amlodipine considered like enhance peripheral vasodilation. Therefore, we use amlodipine for the Raynaud's disease, which is a vasoconstriction of peripheral blood vessels in the hand and feet. Amlodipine available as tablet at 2.5 milligram, 5 milligram, and 10 milligram. Moving to the next medication, diltiazem, and brand name cardiazem. Cardiazem, none again belong to the same group category, non-dihydropyridine, CCB. Diltiazem used for hypertension, for angina, atrial fibrillation, and flutter fibrillation, and control the heart rate. So, diltiazem mainly affect the heart, mainly work on the heart, and consider like intermediate action between the heart and blood vessels. Diltiazem available as tablet, 30 milligram with to 120. That means we have 30, we have 60, we have and so on. Available as extended release, a capsule also available. Diltiazem available as injectable for use in the emergency clinic and cardiology lab. Moving to the next group of next medication in the CCB, we have nifedipine. Nifedipine, the brand name Adalat, and Brocardia, and another name Brocardia here, but the same belong to the same medication. As you can see here, we have the dihydropyridine, we have amlodipine and nifedipine. However, if you speak about diltiazem non-dihydropyridine. So this is the reason here we need to remember. So nifedipine, continue speaking about nifedipine. Nifedipine is very important medication for the hypertension and angina. Nifedipine used for Brinsmetal and vasospastic angina, which mean vasospastic of coronary blood vessels, Raynaud's disease, and preterm labors could be related to the relaxation of the uterus during the labor, maybe, or during around the labor time. Nifedipine available as capsule 10 and 20 milligram, also available tablet extended release 30 and 90 milligram. Moving to Farabamil Galan, brand name, or Veliran, and Farabamil non-dihydropyridine, used for Farabamil, used for hypertension, angina, SVT, atrial fibrillation, heart control, and for the cluster headache like migraine, one of the type of migraine. Okay, so as you can see here, we have two medication belong to non-dihydropyridine. We have diltiazem and verapamil. We need to remember that. And most of the cases here we use it for hypertension, angina, and cardiac arrhythmia. Okay, moving to the group of ACE inhibitor here and ARBs and renin inhibitor. So we have, as you can see here, we have three main group. Most of them work on the kidneys. We have ACE, angiotensin converting enzyme. We have angiotensin receptor blocker. Then we have renin blocker or renin inhibitor. Here we're talking about less of medication. Of course, not all the medication on the list, but we have a huge amount of information here. We have losartan, valsartan. This belong to the ARBs. Then we have candesartan belong to the ARBs. Alskiren belong to the renin inhibitor. Then we have lisinopril belong to the ACE inhibitor. So this is a brief example for the what we have. Next, we have maybe the remaining of medication. Losartan, brand name Quasar, uh, angiotensin receptor, angiotensin 2 receptor blocker, losartan. So sartan belong to the ARBs, sartan belong to the ARBs, and candesartan belong to the ARBs, as you can see. So all these medication, losartan, valsartan, candesartan belong to the ARBs, angiotensin receptor blocker. ARBs used for hypertension, diabetic nephropathy, heart failure, stroke prevention, and left ventricular hypertrophy. Losartan available tablet 25 milligram, 50 milligram, 100 milligram. Again, we have less, more of this medication. For example, we have olmesartan, we have telmisartan. So it's not only these three medication. We have more. Valsartan, brand name Diovan. Valsartan used for hypertension, heart failure, and post MI, left ventricular dysfunction. Valsartan available as 40 milligram to 320 milligram. Moving to the candesartan, Aticand, candesartan belong to the ARBs. You can see it here. Most of the medication belong to the same group, ARBs. Candesartan, the same. We use it for the heart failure, for hypertension with reduced ejection fraction. Candesartan available as tablet 4 milligram, 8, 16, and 32. Moving to the Aliskiren brand name Tectorna, the direct renin inhibitor. So the question from the slide here, which of the following is considered like direct renin inhibitor? So we have Aliskiren and brand name Tectorna. This medication used for hypertension, and it's used limited due to the side effect. Available as tablet 150 and 300 milligram. Moving to the lisinopril, last one, lisinopril, brand name Zestrel, belong to the A-angiotensin converting enzyme inhibitor. This medication used for hypertension, heart failure, post myocardial infarction, diabetic nephropathy, CKD, which stands for chronic kidney disease. Lisinopril available 2.5 milligram, available like 5 milligram, 10 milligram until 40 milligram. Also, lisinopril available as solution, oral solution. Okay, continue speaking about maybe the list of medication belong to the ACE inhibitor and other antihypertensive. We have enalapril, ramipril belong to the ACE inhibitor, enalapril, lanbril, vasotic, and alteis, ramipril. So enalapril, vasotic, ramipril, alteis, both of them ACE inhibitor, we use the same mechanism of action, and ramipril available as capsule, enalapril available as tablet there. Hydralazine available as generic hydralazine. Hydralazine considered like direct arterial vasodilation. Hydralazine used for hypertension, IV emergency during pregnancy. Pregnant women suffer from hypertension. This is an emergency during pregnancy, and then could be used for heart failure combination with nitrate. Hydralazine available as tablet and injection, as you can see here. Moving to the minoxidil available as generic only. We don't have brand name. Minoxidil considered like direct arterial vasodilation. Open potassium channel cause hyperpolarization. Use minoxidil for severe refractory hypertension. We have shampoo from minoxidil we use for male pattern baldness as topical on the skin. Minoxidil available as tablet, could be topical solution or foam 5%. Last medication on the list here, netrobroside, netrobroside. Here we have direct vasodilator by releasing nitro oxide or enhanced nitro oxide. We use for hypertensive emergency, mainly IV, acute severe heart failure, and control hypotension. Okay, so this one of control hypotension here. So we use it for severe hypertension, but we need to control the hypertension. There is a risk of hypotension when you use this medication. This medication available as injectable IV. We use it for emergency hypertension. Okay, so in the second part of antihypertensive drugs, we are going to present a PDF format to maybe show you the complete set of medication. As you can see here, we have the list of drugs affecting cardiovascular system. And the first topic in the cardiovascular clinical pharmacology, we have antihypertensive medication here, as you can see. And this is coming as a part of the maybe entire topic. And this topic belongs to the generic and brand name drug, generic and brand drug names with the pharmaceutical forms for healthcare education reference. I'm Dr. Khalid Hassan, professor of clinical pharmacology and clinical research. Okay, speaking about the antihypertensive medication, as you can see here, here we talk about a group of medication belong to the calcium channel blocker. We talk about amlodipine, brand name Norvasc, clifladipine, deltiazem, philodipine, isradipine, nicardipine, nifadipine, adalat. Then we have naslodipine, verapamil, galan, and it's why most of them come like uh, tablets, and we have one maybe a few of them like coming as a capsule. Moving to the alpha blockers here, as you can see, we have doxazocine, Cardora, Brazosine, Menobres, Tirazocine. So this is a list of medication here: tablet, capsule, capsule. So alpha blocker. Remember, we are here discussing the medication used for treatment of hypertension. However, if you like to mention the entire list of alpha blocker, we have a medication used for benign prostatic hypertrophy, such as psilocybin, tamsuosin. It's not listed here because we don't use it for hypertension. Moving to the other medication, we have clonidine, brand name Catabres, tablets, transdermal patch, injectable, the clonidine alpha 2 agonist, alpha 2 receptor, adrenergic receptor antagonist. Phenoldopan is like belong to the dopamine. As you can see, dopan stands for dopamine, and this one injectable concentrated IV infusion for the emergency hypertension. Hydralazine, medication for especially for the during pregnancy, you are considered safe. Methyldopa, another important medication for pregnant women suffering from hypertension. Minoxidil, this medication available as a generic name only, or tablet. Nitroprusside, Nebride here, and available injectable powder for IV infusion for emergency hypertension. Moving to the next maybe section for antihypertensive, which is considered one of the most first line used medication for high blood pressure. We have angiotensin 2 receptor blocker, ARBs. We have asdisartan, brand name Edarbi. We have candisartan, Atacand tablets. We have irbesartan, losartan, olmesartan, and telmisartan. Valsartan, Diovan also. Moving to the next group, renin inhibitor, we have one medication, aliskiren, brand name Tectorna, available like tablet 150, 300 milligram. Angiotensin converting enzyme inhibitor, ACE inhibitor, suffix brel. As you can see here, we have benazebrel, captopril, enalapril, fosinobrel, lucinobrel, moxibrel, cunabrel, acubrel, ramipril, alteis, and trantopril. So with that, we finished the most popular medication used for treatment of hypertension. So I'll scroll up a little bit to show you what we have. Medication used for hypertension here. Okay, this will conclude this section about antihypertensive drugs that focus on generic generic name, brand name, generic name, generic name, brand name, uh, category, pharmaceutical form, and dosage. Thank you so much for watching and have a great day.